There's nothing much today, but it's just a thought of what all are the chances and what all you can do if you finish your DM cardiology. What I do is very simple: relax, take it easy, have fun, and enjoy life. This is my category, which I think all of us should be doing. Basically, don't put pressure on yourself with numbers. Don't get into the numbers game, and don't spoil your health. Enjoy your cardiology. What you like, go for it. Don't unnecessarily try to do things. But basically, the moment you finish your DM cardiology or your depend cardiology, you just want to do something else. Now, you could either stay in India or you could go abroad. Two choices that we always have, that you want to be here or you want to go abroad, which the family also keeps asking. So what next if you finish deep in cardiology? There is one set of people who straight away want to go into practice. I've done with studies, somebody like me. I said by 30 I should finish all my studies. I finished my DM cardiology and then I said bye bye, that's the end of it. No more studies. So what did I do? I started practicing. More or less like we learned, maybe Justin also would be the same kind, where those days we didn't have those fellowships, so we had to work hard, try to learn from others' mistakes as far as possible. You don't make the mistakes because you won't be in trouble. So learn from that. You more or less a self-made cardiologist, learning over the years, looking at people, asking questions. Whenever somebody does a difficult procedure, stay with them. Make sure that you observe. And one important thing that I've noticed over the years is, unless you ask, they don't tell you. So I used to do with an interventional cardiologist, no names mentioned since most of the people are from Chennai, where I've done about, as an assistant professor when I was in Madras Medical College, I've done about close to 100 interventions with him. Those days, I'm talking about 20 years ago. When I did with him, he never does anything. But the point is, when we are doing cases, I just don't leave him alone. Just keep pestering him with questions. You have no choice but to answer because you're doing the case. At that point, you have to, because you are only two people who can listen. So you must get into the habit of asking what you want and get. You have a doubt, you try to read. But if you don't know, please don't hesitate to ask. Ask is very, very, very important. I've learned my cardiology that way only. So you go to a hospital, you want to practice. There are two ways of practice. You want a quick practice. If you're fairly good in what you're doing, go to a rural area and set up a clinic. That's where your life is very easy. You start a cath lab, you have the money, your cases will come, you will easily develop practice if you're outside the major areas. But if you still want to survive in an urban setup or something, it's going to take time for you to settle down. Just remember that if you want a quick practice, the best way is to go out of the major cities, you're going to have practice. But that is just the way life is. But subspecialty training, there are a lot of subspecialty. Nowadays we talk about the big six trainings, the interventional cardiology, structural heart disease, pediatrics, electrophysiology, nuclear cardiology, cardiovascular imaging, heart failure and transplant. Now I've put 4 in yellow, which are not straight away available here. So what you can do here in India is going to be interventional cardiology, pediatric cardiology, you can do it, and electrophysiology. Professor Narasimhan was here. He teaches people very well there at his hospital in Hyderabad. So it's all known. These things you can do. The problem with structural cardiology, I will tell you, is unless you have a full interventional cardiology training and you're a fellow, you can't go into the structural program. So unless you finish coronary and you're good at it, you have no choice there. So that is important. And back in India, we have the fellowship. I think all of you know about the fellow of National Board. You have to take the fellowship entrance test. It's a straightforward process getting into a interventional cardiology. Sounds very simple, but usually tough because all the cardiologists want to do a fellowship nowadays. So that's going to be tough. So that is going to be there. And there are some institutional fellowships also, apart from the DIP-NB. Like Chitra has got an offer where it does about post qualification. You can do an adult intervention, pediatric cardiology, like cardiac electrophysiology. So these are opportunities. If you look at it, you are going to get these opportunities. Jaydev also has got more or less similar kind of programs, and each one is about a year or a year and a half usually. These structural or interventional trainings are usually more than a year, sometimes about 2 years they work. And these are the other institutes. If you're looking at it, if you're looking at opportunities, probably just have a look at it. In fact, AIIMS has got a PhD program in cardiology also. So if you're interested in becoming a double doctorate, maybe you can look at the AIIMS also for that. Now, when you start looking at going abroad, which a lot of us try to do, we try to think that once you finish your DM cardiology here, you can do a program abroad. Now, is it going to work? How is it possible? Now, there are two things. First thing that you have to look at is what is the kind of program that you get into. Either it's a salaried program or a non-salaried program. The only big difference is salaried program has got a long waiting list. You don't get it fast. And even if you are good in your subject and marks, it takes a long time. Non-salaried, if you're willing to shell out the money, it's got a very short waiting list, you can do it. But the next problem comes in is language. Now, if suppose you're going to anywhere in Europe, in a particular country like Germany, you need to have a very good skill of German. So you need to know the local language, not well, very well. You need to. There is some grading score of 4 or 5, which you have to have, and unless you have that, they wouldn't even take you anywhere there. So that is very important. So if you're planning something to go to some country during a DM evening, go to those German consulates and learn the language, because those not much in demand, but you should know the language. That's very, very important. Looking at opportunities overseas, if you're going to other countries, you have to start from scratch. That is the biggest problem. Like if you're going to USA, you need to clear the USMLE, and then your pathway is first you do a residency in internal medicine, then you do a fellowship in general cardiology, and then you go to the subspecialty. So it's more or less like finish your MBBS and go, don't waste your time doing DM cardiology here. So if you're that category, you're not going to be sitting here listening to me. So I think we are out of that category. Similar thing happens if you're going to the UK. If you're doing an MRCP pathway, you get a SHO post first, then you need 6 numbered posts. All posts are not numbered, only some are important and numbered. So if you do 6 numbered posts, you are eligible to take an MRCP exam. Then you take the MRCP, and then you do 6 numbered posts in cardiology, you get the CCS, after which you are a trained consultant cardiologist. So that is how the system works. You are eligible to a consultant after you do 6 in internal medicine and 6 in cardiology. So this is going to be a different pattern. The other country, only country where you can go is Australia. The problem is getting there is tough, but the easiest good thing is following your MD or DM cardiology here, you can straight away go for a fellowship. You can do a fellowship and come back. That is possible in Australia. So that is one opportunity you can look at. So what next after cardiology? We have seen all that we have seen. Practice, subspecialty, different kind of subspecialty, and it's important to note that structural heart disease, which is where most important right now, people go from here. I have had people, friends of mine, going from here to the US for structural heart disease program without going into the general medicine program. But you need to have some publications, experience, and lot of things, lot of sub-criteria, classification, some waivers. With that, you can probably go for a 1-year structural heart disease training program. It is possible, but the route is not very easy, and you should have been a consultant for quite some time for that. The other specialties like nuclear cardiology, cardiovascular imaging, heart failure and transplant, they are all there, but I think here in India we are pretty nascent. I don't think we have much of a, we have a very good experience in heart failure management and transplant. Maybe Justin should start it in one of the colleges where he is sitting, where we could have an exclusive super specialty, subspecialty in heart failure transplant, because India, one of the biggest centers for heart transplant is Chennai. It's possible only in Chennai, because Chennai has got the huge number of heart transplant patients, not heart, liver transplant also we are pretty well known. So we are very good in transplant, so we can start looking at that also. And you can do a direct fellowship also from Singapore. That is one more option you guys have. You can do a fellowship training in adult heart disease, congenital heart disease, clinical cardiology, interventional cardiology, EP pacing, echo, nuclear, heart failure, cardiac imaging, cardiac CT and cardiac MRI also. So all these are possible. So what I have done over the last few minutes, probably before lunch, I didn't want to push you in the last, let's say about 6-8 minutes. I have told you all the different routes and approaches, and my own route was the first one. Still enjoy life. Ultimately, don't forget yourself. Don't push too hard and get into trouble, because I have lost friends of mine in their 30s and 40s because they pushed too hard. They started a cath lab, they wanted to get it going, and I lost a very close friend of mine because of that. But it never works for me, because I've never been after the numbers game. I don't know whether you've seen me running around in this conference. I've been the treasurer. Probably I'm the coolest guy in the entire thing, handling about the entire cash system with me. So far before the talk, what I was doing, Ashish Deshpande came in and asked me, what are you doing looking at the talk? I said, I'm transferring money to the bank, from the bank. So don't worry about it. First, look after yourself. Take care of yourselves. All the best, and thank you so much for the patient listening. I don't think we can have questions on this.